Medical news from European Heart Journal. Endophilin A2 improves endothelial dysfunction by counteracting eNOS proteasomal degradation. Endophilin A2, Endo A2, emerges as a critical safeguard of endothelial nitric oxide synthase, eNOS, protein stability, and its loss precipitates a rise in arterial pressure that rivals classic models of hypertension. By preventing proteasomal degradation of eNOS, Endo A2 preserves nitric oxide, NO, bioavailability, a finding that could reshape therapeutic strategies aimed at restoring endothelial function in hypertensive patients. Hypertension remains the leading modifiable risk factor for cardiovascular morbidity and mortality, largely because the disease is driven by endothelial dysfunction and the consequent attenuation of NO production. Although eNOS activity is known to be modulated by phosphorylation, acetylation, and other post-translational modifications, the mechanisms that dictate its protein turnover have been incompletely defined. Endo A2, a membrane-shaping protein highly expressed in the cardiovascular system, had not previously been linked to eNOS regulation, prompting investigators to explore whether this protein might influence blood pressure homeostasis through a novel post-translational pathway. The researchers generated both global and endothelial cell-specific Endo A2 knockout, KO, mice using CRISPR/Cas9 and CRE-LOX strategies, respectively, and implanted radiotelemetry probes to obtain continuous, high-resolution blood pressure recordings over a 4-week baseline period. Parallel cohorts were subjected to angiotensin II infusion to assess susceptibility to pressure overload. Vascular reactivity was examined in isolated aortic rings using acetylcholine-induced relaxation assays, while eNOS protein levels, ubiquitination status, and proteasomal activity were quantified by immunoblotting, co-immunoprecipitation, and proteasome activity assays. In vitro, cultured human umbilical vein endothelial cells, HUVECs, were transfected with Endo A2 siRNA or overexpression constructs, and treated with the proteasome inhibitor bortezomib to test rescue of eNOS degradation. Mice lacking Endo A2 displayed a sustained elevation in systolic blood pressure of 12 plus or minus 2 mm of mercury compared with wild-type littermates, p less than 0.001, a magnitude comparable to that observed in the angiotensin II-treated group. Endothelial-specific KO produced a similar hypertensive phenotype, delta SBP equals 10 plus or minus 1.5 mm of mercury, p less than 0.001, confirming that the effect originates within the vascular endothelium. Functional studies revealed a 45% reduction in acetylcholine-mediated vasodilation in Endo A2 deficient aortae, p less than 0.01, whereas sodium nitroprusside-induced relaxation remained intact, indicating a selective impairment of endothelium-dependent NO signaling. Immunoblot analysis showed a 60% decrease in total eNOS protein in KO vessels, p less than 0.001, without a change in eNOS mRNA, pointing to post-translational loss. Co-immunoprecipitation demonstrated heightened polyubiquitin attachment to eNOS in the absence of Endo A2, and proteasome activity assays revealed a twofold increase in chymotrypsin-like activity, p less than 0.01. Treatment of Endo A2 deficient mice with bortezomib restored eNOS protein to 90% of wild-type levels and normalized blood pressure, delta SBP equals minus 9 plus or minus 2 mm of mercury, p less than 0.01. In cultured HUVECs, Endo A2 knockdown reduced eNOS half-life from 8.2 H to 3.1 H, p less than 0.001, an effect fully rescued by proteasome inhibition. Subgroup analyses indicated that the protective role of Endo A2 was most pronounced in male mice, where the blood pressure increment exceeded that in females by 3 mmHg, p equals 0.04. Moreover, Endo A2 expression correlated inversely with markers of oxidative stress, for HNE adducts, in human arterial specimens, suggesting that the protein may also modulate redox-dependent eNOS uncoupling. Thank you for watching. For the full article visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.